All right, everyone. So I'm going to be going over in the next 10 minutes about the body structure and medical terminology. It's very important we kind of understand these concepts. Reason being is because you as medical assistants, other physicians, nurses, everybody that we work with, we need to make sure that we're corresponding to the correct location. So universally, we've been able to construct kind of a system through structure and terminology so everyone is on the exact same page. So for example, if I say right arm to the patient, it's gonna be their right arm. But if you're looking at the patient, you kind of look on the right side, that's gonna be their left arm. So this can get a little bit challenging. Okay, and I'll go ahead and go through the kind of basic fundamentals that you kind of need to know off the bat, which is why I'm going over them with you right now and kind of this additional asynchronous portion of the class. I'm also going to post this up on the links in the announcements. If you ever want to check it, they will be right there for you. All right. So getting into the anatomic position. So the anatomic position is a frame of reference that is used to name the surface anatomy. Now, this is your general standing anatomic position. This gentleman here is standing up, upright, facing forward with his palms forward like so. Okay, so whenever we refer to things, anatomically speaking, this is your anatomical general standard position. Okay, so he's going to be standing erect, facing forward, arms will be at the sides, and his palms forward and toes pointed forward, just as we mentioned. So this here, textbook example of an anatomical position, or position. All right, don't get carried away with learning all of these different terminology names just yet. I do want to specify as far as what ventral surface means. So ventral surface, anything ventral is going to be on the front or the anterior portion, okay? Most of the time we'll use the term anterior, but you can say ventral side as well, or ventral surface anatomy, that's probably fine, but just know that ventral is corresponding with the front. So these are some of the things that are on the front side of the body. We have the nasal cavities, we have the eyes, the ears, the nose, your biceps, all of this is on the front side of your body, your quadriceps, all on the front side of the body, okay? And actually a cool portion over here, we have some combining terms in regard to the anatomical structure. So bucc means cheek, cephalo means head, and cervical is combining form for a neck. So, cervical spine has to do with the neck. Encephalopathy has to do with the head, and then buccal has to do with the cheek. So that's kind of where all of this stuff derives from. We'll get more into these as we learn throughout the chapters. All right, once again, more stuff in regard to the head. We have, facial, that has to do with the face. All of this is still on the ventral side, which the ventral side is the front portion of the body. All right. Once again, so on the front portion here, mento means chin, and nape, such as the nasal cavity, means the nose, okay? All right, some other portions here. Oculo is in relation as a combining form for the eye. Oro, oral surgery in relation to the mouth. And otto, which is actually what we're covering now, is gonna be for the ear. Now there's other words for the eye as well. Another one is ophthalmo. And we also have auto here for the ear. When we're talking about our otoscopes, it's going to be for a scope to view the ear. Okay. Other portions. So all these that I've just covered are on the front side of our body. Once again, different areas here, abdominal, kind of the stomach region, axillary, kind of one we may not be familiar with, but axillary has to do with the armpit region here. Inguinal, if we've ever heard of inguinal hernias, it's going to be in this area right here. Mammary, when we talk about mammary glands, it's right here in the breast region. We have pelvic, so we have the pelvic region right over here. Sternal has to do with your sternum. So this bone right here is known as your sternum. We'll talk about that later in the chapter when we're going over CPR. Thoracic, very interesting with thoracic. Now, thoracic spine is going to be on the posterior or dorsal side, which we'll get into next. But thoracic can also be the thoracic cavity, which is the front. Okay, so don't get confused with that. Thoracic cavity is the front. Thoracic cavity houses the lungs, the heart. So don't get confused on those aspects, okay? Some of these that I'm going to go over here, the word parts, some of them are very similar, but some of them are not, like coxo means hip, okay? Inguinal means groin, mammo equals breast, pelvis pelvis, sterno is breastbone, thoraco or thoraco is for chest, and umbilico is for umbilicus. So you kind of see how these word parts combining forms as well mean the corresponding locations. All right, so we've already covered a lot more stuff on the front of the body, as you can see, as opposed to the back of the body. Anti is forward, in front of, or before. So when we're talking about the antecubital region, that's going to be on the front here. So if I'm standing upright here and we are drawing blood from the antecubital region, it's going to be kind of in front of the elbow, right in here, okay? It's just as known, elbow. So antecubital, the dash AL at the end is a suffix. Put all those together, we have in front of the elbow, okay? So that's the word parts pretty much. I think we should have already covered in this chapter. I mean, we'll go more in depth here in class, but if you kind of want to get ahead in the chapters, you know, just watch this video. So a lot of terminology and ways that I say things will be using these word parts, this terminology, so you're not kind of confused and blindsided, okay? All right, now we have the legs as well. You know, a femur has to do with the breast, I'm sorry, the bone. Femur is actually the biggest bone in the body. Patella is for the knee. Then we have our tars in regard to the ankle, plant is for the toe, and pedo is for the foot. If I'm standing upright, erect, all this stuff can be witnessed here on the front side, down this way, down here, and on the front, okay? That's gonna be the ventral surface anatomy. All right, now getting into the dorsal surface anatomy. So you see this fine gentleman here, he went ahead and turned around for some. This is going to be the posterior portion or the back side, okay? Dorsal. You know, if you think of a dorsal fin on an animal, that's what we're talking about here when it comes to the surface anatomy, okay? So there's different regions here. We're gonna go through some of these word parts. So the dorsal means back, glute, so your glutes. It's gonna be your buttocks. Then we have a lumbo, means the loins here. Right in here, we have the nuke. So this might mean neck, you know, kind of a nuchal cord on a baby when they're being born, when the cord is wrapped around the patient's neck. So be cautious on that and make sure we're using the correct anatomical word parts for it. Vertebra, that's going to be the spine along your backside. Popliteal is going to be the back of the knee. And we'll go over all of these in class. I just kind of wanted to give you a heads up on some of these things here. But take a look here at all these anatomy points here in different surfaces. I'm sorry, one surface, which is the dorsal surface, but there's different anatomical structures here. So, you know, femoral has to do with the thigh. Sural is the calf. Now, the common thing all of these have is that they're all on the posterior portion or the dorsal surface, and then on the dorsal side as well, okay? Majority of the time, we're gonna use the terms posterior. So posterior and dorsal are somewhat interchangeable, and you'll see kind of how this works. All right, so getting into anterior. Anterior is gonna be the front, just as I mentioned, so anterior would be ventral as well. Usually when you're saying in directional terms, it's gonna be on the anterior surface. So that's gonna be towards the front. As you can tell here, also ventral, okay? So anterior and ventral go hand in hand with one another. All right, next we have posterior. So posterior is gonna be towards the back, okay? Towards the dorsal surface anatomy, which is back here. So we have the gentleman facing towards the front. When we talk about posterior aspect, it's gonna be towards the back, okay? All right, so antero-posterior, we have this gentleman here facing forward. So it's gonna be, antero-posterior is gonna be the front, and then turns to the back, and then posterior-anterior start with the back and then turn to the front. So don't get too confused with these. We probably won't be using these too much, but I kind of just want to show you, and a lot of time this is going to be used in performing x-rays, okay? Some patients may have to start in this position, turn around, and take an x-ray from the other side. All right, very important part here. So I do need you to understand this information here. When we're talking about positional and directional terms. So for the directional terms, when we're talking about being superior, so, you know, superior, think someone's superior, going upwards, you know, someone's superior, then you're on top, I guess. So with superior, it's going to be going upwards in the upwards direction, okay? Now we have inferior, which is the lower portion. This all relates to the midline of the body here. at the umbilicus, okay? So where your belly button is, the umbilicus region, that's kind of where we split up these terms, okay? Now, saying it is a little bit tricky, so kind of understand this, and if you need practice, no problem. But the head is superior to the knee, okay? So that's the way we say it. So the head is up here, it is superior than the knee. We do not say the knee is superior to the head because that's false. The knee is actually below the head, okay? Now I could say the knee is inferior to the head. Okay, so that would make sense. And the head is superior to the knee. All right, another example, let's say we're going to be talking about the sternum, and let's go with the abdomen. The sternum is superior, sternum is higher than the abdomen, okay? The sternum is superior than the abdomen, okay? Now we're going to reverse that. We want to talk about the abdomen is inferior, so it's lower than the sternum, okay? So mention whichever one first that you're trying to describe, okay? Might be a little bit confusing at first. Follow examples online and with me in class, and it will make more sense once you practice it, okay? All right, now when we're talking about medial, this is the midline portion of the human body, so it's right down the middle, okay? Now when we talk about medial, it's gonna be going this way, only towards the midline. So I would say the sternum is a medial to the deltoid, so this way. So sternum is right closer to the midline of the body. The deltoid is going to be outside. So I would say, if I want to talk about the deltoid is lateral to the sternum, okay? It's pretty much how we describe things. Let's say if you have a rash and it's moving laterally away from the midline of the body, okay? So that's kind of the terminology that we use. A lot of the times, to be honest with you, when you're, writing this stuff down, and your chief complaint as medical assistant, sometimes the simplest is better. I work with doctors, just mention it like this, normal terms, but you will have to know these terminologies for any type of advancement in your healthcare field, or whether you are testing out, especially for the medical assistant certification exam. That's why I kind of, hammer these combining forms into, so you know them, you memorize them, you learn them individually, the prefixes, the combining forms, as well as the suffixes, all respectively on their own, because they are interchangeable throughout medicine, healthcare, and you'll see them in different ways, as opposed to just trying to memorize the words one by one. You won't get anywhere that way. All right, here's another very interesting one here. So ipsilateral, it's going to be pertaining to one side of the body. Now contralateral is going to be towards opposite sides of the body, as you can see here. So the rash affected the patient, ipsilaterally, on whichever side of the body. And, patient had a stroke that affected him contralaterally. He had some slurring. Let's say he had a droopy eyelid on droopy right eyelid, and then he had, let's say, his left leg gave out, so that's affecting him contralaterally on opposite sides of the body. May not use this one too much. You might just locate them individually, but it's good to understand how this is affecting the patient. All right, unilateral, most important here. Unilaterally is only going to be on one side, bilaterally is going to be on both sides. So let's say the patient was hit by a vehicle, and now they have pain in the neck. Is the pain going to bilateral radiating, meaning traveling through both arms? So is it going down bilaterally, or is it just one arm? Okay, and if it's only going down one arm, pain is radiating down the left arm. Okay, so instead of pain is radiating down the right and left arm, you can just say the pain is radiating down bilateral arms, meaning left and right. So bi means two. Usually the way the human body is composed of, we have kind of mirror sides. So one similar looks like the other. Outside aspects, obviously inside it, we're built a little bit different, but on the very anterior portion, so having to do with our skin, the way we look exactly the same from one side to the other, minus some small characteristics. But generally speaking, it's bilaterally when we're talking about legs, arms, feet. You have two hands, you have 2 feet, 2 eyes. Only got one nose, so you can never say bilateral noses. Okay, so we have one nose, so be cautious of that. All right, this one is the one that kind of is very tricky to specific to certain people. It's kind of like superior and inferior. Now, when we're talking about superior and inferior, we are only talking about, the trunk of the body. So when we refer to superior and inferior, inferior is down, superior is up, it's going to be towards kind of the trunk of the body. So this area here, we have our thoracic cavity, and then we have the abdominal pelvic cavity right here. That's when we're talking about the directional terms. Now, in relation to the limbs, so we're talking about the shoulder all the way down to the fingertip digits, and then shoulder, fingertip digits. Then we got our legs over here. We refer to it as proximal and distal, okay? Now it's to the point of attachment. So it's going towards the shoulders here when it's in relation to arms, where our limbs are attached for our arms at the shoulder. And then for the legs, it's attached here on the hip portion. So that would be proximally, okay? Now distal is kind of going the distance, so the furthest point. So we have it traveling towards, our digits here at the very end, and our toes distally. So let's say I have a pain. Let's say I'm describing the ankle. So the ankle would be distal to the knee. Okay, so the ankle's down here and the knee is up here. The ankle is distal to the knee. Whereas I could say the knee is proximal to the ankle because the knee is closer to the point of attachment right in here. This may take some practice, but whichever one, my best bet is whichever one you're starting off with, name that structure first. So name the knee. That one is proximal because the knee is closer to attachment than the ankle, okay? Now, I can never say the ankle is proximal to the knee. Reason being is because proximal is closer to the point of attachment. Which one's closer, the knee to the attachment or the ankle? So it would be the knee is closer to attachment. Don't get too confused on that. Sometimes it takes a little bit of practice. The more you see it, the more it'll make sense. But proximal and distal is only in relation to the limbs, the arms or the legs. You're never going to say, the chest, or I'm sorry, the sternum is proximal to the abdomen. Arrow-wise speaking, does make sense, but we're only using the terms proximal and distal for the limbs, only our extremities. We have our upper extremities and we have our lower extremities. Now, we kind of did this today in wound care, which was very cool. A lot of the wounds that we're treating, some of them may have been deep, some of them may have been superficial. A lot of these were deep. Superficial is kind of like a paper cut or something on the surface of the skin where it doesn't really expose too many layers of tissue, whereas deep goes a little bit further. Okay, so we had a lot of deep wounds today that we had to pack and dress. We're gonna pack the gauze inside and dress them up. Okay, so you got our deep wounds, a little bit more, severe. You have our superficial ones. I mean, they still can be severe, but those are going to be on the outside of the body. Okay. Also important that we need to understand is supine and prone. When we're talking about supine position, it's going to be laying flat on their back, just as so, looking up towards the sky. Easiest way for me to remember, supine starts with S, sky starts with S. The patient's looking towards the sky, they are supine. Okay, now with prone, we used to always have to, when I fired rifles in the military, I'd have to get out of the foxholes and fire in the prone position. So I'd have to be face down with my rifle in the prone position. So prone is face down. That's the way I've always been able to remember. Supine is going to be facing upwards. Prone is facing downwards. And very important to know, especially as a medical assistant, because the doctor is going to tell you, hey, this patient needs to get in the prone position for a, let's say it's a hemorrhoid removal or whatever it may be. And if you have them in the supine position, it's going to be awkward because the patient's going to have to flip over because that's not the correct position if you're trying to remove a hemorrhoid, for example. Okay, so there are different types of positioning as well. I'll probably get to that in another tutoring video here, but do know the different these two positions, especially because when we're performing procedures on patients, whether it's surgery or whatever it may be, they have to be in a specific position. I am not going to do a breast augmentation if the patient's in the prone position. That just doesn't make sense. So the patient has to be in a supine position. All right, I'm not going to get into the body cavities on this. I will post another video tomorrow covering the different body cavities. But as long as you can understand, the different anatomical terminology for these major areas, you should be fine and well. I will cover them throughout our courses. We get new students that punch in. That's perfectly fine. And it's not going to be a repeat of everything, but you will start picking them up as we go through. If you have any questions, let me know. You can reach out to me, class or email. Not a problem. I love going over directional terminology and making sure that everybody understands it effectively. All right, thank you and have a good day.